a Zoom report. So what we're gonna do is we will go over, I do a PowerPoint for my reviews, and hopefully that'll be helpful for you. I just find that's usually most beneficial for everybody. So let me share that with you, and then we will open it. Any questions? 50 questions as usual. 5 math. What else can I tell you? Study your math from that the Calculate with Confidence. That's where we'll pull those from. And let me see what else I have here. And if you make sure you have a whiteboard for your math so that you can be prepared for when you guys do your HESI, okay? So we're going to take a look. Here's my PowerPoint. I can't share the PowerPoint because it's not published. So, but you guys, if you want to see it again, you can just review my video, okay? So we're going to take a look at, let's do it as a slideshow because it looks nicer that way. So we look at our consequences of poverty. We know that we talked about in my class and other classes that the groups at highest risk in these poverty areas are children, minorities, single parent, and women-headed households. Among racial, we know Hispanic rate is higher in our poverty areas. Number of college degrees, we talked about the relationship between education. And we know that the lower the education, the higher rate of poverty. So it's that inverse relationship. And what's that do to unemployment? So we know in our rural communities, we don't have great areas. I show you this picture because I want you guys to remember they're always bent over in those rural areas. Those migrant workers are always bent over. So they're going to be have musculoskeletal issues, back and neck pain, lower back pain that can radiate to one leg, we know is sciatica. So we assess the client to see whether the pain is aggravated by bending, lifting, coughing, sneezing. Okay, and that's our sciatica. We know our health risks. We have chronic illness higher in our rural areas. I want you guys to think about that. It's because these patients in the rural areas don't have a lot of healthcare providers. So they're very spread out. They're going to have a decrease in leisure time, like fun time, decreased compliancy with safety precautions like seatbelts. They're not going to do their preventative health screening, so you're going to see chronic illness higher. Know that we also have concern in our rural community where they don't share a lot because everybody kind of knows everybody. So we're going to have less likely reporting of sexual assault, drug abuse, or depression. Primary prevention for our pesticides, of course, we're gonna provide education, teach workers how not to be exposed. We're gonna provide our hand washing stations and screenings like urine testing as secondary. And then we're gonna do that treatment for them when they have exposure to pesticides. Any questions about rural community, what we need to know about it? I'm going to repeat this. There's a decrease in overall health status when compared to urban clients. We know that chronic disease is going to be more prevalent in our rural clients. To prevent exposure, we talked about education. We talked about hand washing for secondary and conducting screenings, and tertiary is going to be our treatment. We're going to take a look at our cultural considerations for our Mexican culture. We know the nurse is considered to be an authority figure. We want to maintain their dignity, and they expect some like chit chat with each other, with the nurse and them before they have encounter any problems. You're going to be just really friendly with our Mexican culture. We know our families with kids, unfortunately, is our fastest growing homeless population. Single motherhood is increasing. And we know lack of education, lack of poverty. So what are we going to do for our single mothers? What are we going to make sure that they continue with? Anybody? What are we going to make sure they keep going with?
Yeah.
Say that again.
Nutrition. Yeah. Nutrition.
No, it's correct. Direct
Second,
correlation
Commissioner.
between education and poverty. So we're gonna make sure our single moms stay in school. Okay, we give them as much education as we can to help increase their chances of not being in a poverty-stricken community. A direct correlation we know is between poverty and poor health outcomes. Poor teens are 3 times more likely to drop out of school. So chances are we have to make sure that we keep them in school, okay? Particularly our pregnant and have them go back to school as soon as possible. We know about homeless, right? Our homeless people have the same problems accessing care as those doing poverty. They're usually crisis oriented when they go to your ERs. Cost of caring for them is high because they don't have anything to reimburse. And so living on the streets is going to increase risk behaviors, such as we're going to see a higher risk of communicable diseases, AIDS, hepatitis, more likely to use alcohol, right, and illicit substances. We know this about our adolescent homeless population. Vulnerable and populations in HIV. Remember, our HIV is going to be transmitted. We know this. And clients who fall into the high risk category are going to be those who use drugs, those who have persistent and recurrent sexually transmitted diseases, and those with multiple sex partners. So those are our 3 big groups. When we're looking at our community and youth violence, we want to make sure that we are increasing social skills with our teenagers, because we see a direct correlation between increase in social skills and a decrease in violence. We look at alcohol and drugs. Please do know the dangers of mixing meds with alcohol, those that depress the central nervous system. Somebody give me an example of something that depresses the central nervous system.
Narcotics.
Yep. What else?
Or Azepam.
Say that again, Elizabeth.
Like your anti-anxiety, like, is that right?
Some of them will, but not necessarily. Like more of our like barbiturates, you know. We're going to see that depressing the central nervous system. Know that we have a physical, psychological dependence, and we see our risk factors with violence, trauma, genetic connections, and mental illness. We know our dangers about vaping. What do we know about vapes?
Two pack cigarettes. One vape, 2 pack cigarettes.
Well, maybe, but that's not what we worry about with vapes and with young
Cancer,
kids.
cancer.
Well, not cancer. We don't know really with vapes.
What's the question?
So we know that our oils and our vapes are poisonous to young children. So it's going to be important.
Passive. Second-hand smoking.
No, not secondhand. We're going to worry about the oils, okay? So that's what we look at with vapes. And we know that they can be poisonous. We talked about parish nursing last week. Congregational is going to be when we focus on just one congregation. And here you're going to be really autonomous in congregational because you're working by yourself really. And then we have that institutional one where we act as a liaison between the church and we have help when caring for others. So less autonomous in our institutional model. Spirituality versus religiosity. Religiosity is a specific religion. Spiritual is just an attitude about a higher being, okay? For the parish nurse, we do primary prevention, hold classes with youth and parents on healthy eating, encourage a variety of activities, healthy snacks, parents to be proactive in school councils. Secondary prevention, we're going to do weight screenings, and tertiary prevention as a parish nurse, we can do our weight reduction support groups. I want you guys to know about care plan and nursing process. We're always going to be steering the conversation towards goals. The nurse is making sure that they identify mutual outcomes. When we look at discussing health problems and limitations, we're going to be looking at our assessment phase, and then we get our diagnosis and planning after our outcomes, right? You need to know the difference between Medicare and Medicaid. Remember, our Medicare is going to be those that are over 65. We know that we need to have skilled nursing care in order for Medicare coverage in the home. So caring for a new wound and teaching family members how to provide care demonstrate the need for a nurse. Nursing service must be skilled, so custodial services like sitting and assistance with dressing and going to the bathroom, not sufficient for Medicare reimbursement. We compare the two, and I told my class this, and it's a good way to remember. Medicaid has the word aid in it, so it's going to be a lack of financial resources. And Medicare, we're going to give care to those that are 65 and older. And I'm going to re-emphasize Medicare will only pay for home health care by skilled professionals, where Medicaid does not require these kind of strict things. So they can have home health aides if you're Medicaid eligible. What is our primary goal of hospice care? It's always going to be dignity.
Comfort.
Yeah, dignity, care, and comfort. Our federal agencies, when we look at community nursing, we're going to have the World Health Organization. We're going to have OSHA, which we talked about tonight in class. That's going to be our occupational nursing. And then Agency for Research and Quality is going to be for nursing research and quality. So do know that. Epidemiology, we spoke about tonight. Epidemiology is going to be the study and the distribution of factors that determine health-related states or events in a population. We have analytical, and that's going to look at the causes of a disease and determinants, like why do some people get something and some people don't, and how does it occur? We are going to remember our epidemiological triangle, our host, our environment, and our agent. So disease is produced by exposure of a host to an agent and the presence of environmental factors. We know when it's crowded housing, poor housing, pollution, noise, all those things, you're going to be more susceptible to other things. I want you to know the case fatality rate, CFR, is the person is considered an estimate of the risk of death within a period for a person. So people will say, how much time do I have? It's going to be your case fatality rate. We know when we're looking at environmental stuff, our people with immune deficiencies are at higher risk for illness if they do take in the contaminated water. Healthy People 2030, we look at what are we trying to do with environmental health. We're trying to increase work sites that offer health promotion, employee physical activity, employee nutrition, reduce deaths from work-related injuries, pneumococcal deaths, and work-related assaults. Okay. How's our environment impact our health? We know we have air pollution, water, chemicals, radiation, noise, occupational risks, agricultural risks, our environments, and our climate changes. And we're gonna look at, I want you guys to know these types of studies. This is in our epidemiological chapter. We have ecological, which are quick, easy, inexpensive. We do it with data that we already have, right? So we're gonna look at why, what group has something, and then we can use that to prompt further education, right? And find out, is there something else going on? Is this why? Okay. So then we have the cross-sectional, and that's going to be where we look at different things. We look at a problem and then how often it's prevalent. So it's a cross-sectional. It provides a cross-section of a group, and information is on current health status, personal characteristics, and risk factors. So there's a simultaneous collection of different data. Then we have retrospective cohort. Retro, I want you guys to think of the word retro to mean behind, back. Retrospective, these studies rely on existing records, such as employment, insurance, hospital records, to define a cohort that is classified as being exposed or unexposed. And our cohort is followed over times and the records to see if the outcomes occur. We know our role of our occupational nurses to work in manufacturing industries, service, healthcare facilities, construction sites, government settings, and we're going to work to promote the health of healthy environment, prevention of adverse health effects. And that takes us to the end of my PowerPoint. I'm going to stop sharing right there. What kind of questions do we have on this review? I do go through my reviews relatively quickly, but what questions do you guys have?
It's just a lot to learn. It's just a lot. That's it.
Feels like a lot.
Yes.
Okay. Well, is there a concept or something that we want to go over as like you'd like to go over maybe to make it easier for you? For those studies, what I want you to do is know the ones that I told you specifically.
Okay.
Always think of retrospective as backwards. So we're looking at stuff that already occurred. And then we have those cross-sectional, and what you're doing is you're crossing things. So that's the way I like to remember it. You're crossing different pieces to see what outcomes you get. So that's just an easy way to remember two of them.
Okay.
Okay. I know it seems like a
And
lot.
what math will,
I can't be specific with math. I need you guys to know how to do math generally.
no, what kind will be?
Yeah,
how
the only
many
thing I need
questions?
to- 5 math questions. And
Uh-huh.
it'll be, dosing milliliters per hour, possibly a kilogram, possibly a conversion on weight. That math I want you guys to review on the website that we give to you. Go ahead, Elizabeth. Did you have a question?
What website I did not find?
It's under your the announcements on our first couple announcements of the quarter. Did you have a question, Elizabeth?
Are there any Kahoots for this?
I don't have a Kahoot. Professor Price, let me see what she's got. Mhm. Let me ask. And let me ask her. We have AdPi, we have evidence-based practice, we have week 5 Kahoot. I did that with my class this evening. Do you guys have access to those?
I don't.
No? Here, I'll put them in the chat box here. And that way you can pull them up if you want. There's one. There's AdPi. Oopsie. Any other questions while I'm doing these Kahoots? No? You guys are all pretty quiet. So it feels like a lot of content, but what I try to do is cover in my reviews the material that I want you guys to focus upon. Okay, and so hopefully that's been helpful. What else can I do for you?
I'm not sure.
Nothing? Everyone's quiet.
Okay, thank you.
Okay,
Okay,
you're
thank you.
welcome. You're welcome.
Bye.
Thank you.
Thank you.
Bye.
Welcome.
Thank you.
You're welcome.